Good morning, everyone. My name is Margaret Sumukad. I'm from BSN 2A7 and I'm here to perform the female catheterization. So, let's do it. Hi, ma'am. I am Margaret Sumukad. I am your nurse for today, so I am here to perform catheterization for you. So, the first one is we need to check the doctor's order. So, the doctor's order. Okay, perfect. So the next one is we need to prepare all the materials needed for catheterization. So I have here all the materials needed for catheterization. So the next step is identify the patient's name and ask her for any allergies she have. So, ma'am, what is your name? So you are Carmela Sumukat. What is your date of birth? So perfect. So, ma'am, you have any allergies of food or any allergies of seafood or any allergies you have? So you don't have any allergies, so perfect. So the next step is ensure for the privacy of the patient. So we need to close all the curtains. So I have closed all the curtains. So the next step for after ensuring the privacy for the patients, we need to position the patient in lithotomy position. So ma'am, are you ready? So, we want you to position into lithotomy position. So, your knees are flexed here. Okay. So, after positioning the patient, we need to perform hand hygiene for the procedure. So, I have here alcohol. So after performing the hand hygiene, we need to prepare the materials for cutting. So I have here the materials for cutting here. After preparing the materials for catheter, we need to put 8 sterile gloves in our hands to prevent contaminations. So I have here the sterile gloves. So need to put this to perform the catheterization. So the next one. So here, perfect. Put away the plastics. So after putting the sterile gloves in our hands, we need to put the sterile drape in the patient's bottom. So I have here improvised the sterile drape here. This is a sterile drape. See? So ma'am, can I ask you to raise your hips so that I can put the sterile drape in your buttocks? So here. After putting the sterile drape in the patients, we need to do the antiseptic solution. So I have here a alcohol swab. So after preparing the alcohol swab, is we need to put the 10 cc syringe into the port of the catheter. So we have 10 cc of syringe here of water, and we need to put it into the catheter. The 10 cc catheter and the 10 cc. So we need to put this in here. So do not inflate. Remember, do not inflate the balloon. Here, I have inserted the water into the port of the catheter, and so we need to pull back the syringe. And perfect. So put away the syringe. So after putting the 10cc syringe into the port of the catheter, we need to lubricate the catheter. So we assume that this is a lubrication. So here, and we have an alcohol swab for the antiseptic solution. After we inserted the 10cc syringe into the port of the catheter and lubricate it, we need to clean the meatus of the patient. So we have here, we assume that this is an alcohol swab. So my non-dominant hand is I am to put here in the meatus of the patient. So we need to clean the meatus. Here, the first one is the right side. So here, after pin, exaggerate and put another alcohol swab. So here in the left side of the vagina of the patient, to the anus, exaggerate here, and the last one is to the center. 1, 2, exaggerate and put, and we are ready to put the catheter into the urethra of the patient. So we are ready to insert the catheter into the urethra opening of the patient. So ma'am, are you ready? So 1, 2, 3, inhale, exhale. So that's perfect. Okay, so I have seen some urine in your urobag, so we need go down 2 centimeters. So we need to go down. Okay, that's perfect. Oh, I have seen the urine into urinary bag. So we need to put the urobag in the bedside of the patient. Here, the urobag in the bedside of the patient, we need to assume that this is a stabilizer. We have a stabilizer. Put here in the leg of the patient. This is a tape. So that's all. So after putting the catheter into the urethra of the patients, so it's perfect, ma'am. And the next step is you need to dispose all the materials that are used to the catheter. So we need here, put that away. Sterile gloves. After putting away all the materials that are used in performing the procedures, we need to assist the patient for the comfortable position. So these are down here. So thank you, ma'am. And lastly, we need to document all the important details that are performed for this procedure. So that's all. Thank you.